Every day, all over America, thousands of nurses leave their own homes and go to work in the homes of their patients. And with them, they bring a friendly smile, a caring attitude, and the best health care in the world. And sometimes a hug, too.
The quality of care that the patients get in home care, I feel, far exceed what they could get anywhere else.
I am able to make a difference in people's lives in home care.
I think being able to have your sole focus on the patient, not be interrupted when you're taking care of the patients at home, goes such a long way.
Whether they travel by old country roads, crowded city streets, or quiet suburban lanes, home care workers will cover almost 8 billion miles this year to deliver the best care in a comfortable setting, where the patient's health and needs are the sole focus of attention and the only things that matter.
Hi, how are you doing? Very good. Good to see you again. It's really wonderful to be out in the field seeing patients in their home where they're most comfortable. It just adapts really well to their comfort levels, and I really like that I am able to focus on them 100% when I'm in the home with them. I don't have my phone buzzing or my pager going off and being pulled into different rooms taking care of 5 or 6 patients at the same time. They're my priority when I'm in the home. Nothing else matters except taking good care of them.
What I like about home care is the flexibility of the schedule and the one-on-one time I get with my patient. We're not disturbed. They just have me all to themselves. We build good relationships and great rapport, and you meet their families, and I wouldn't have the opportunity to do that in any other setting. Hey, Mr. Shane.
Hey, good to see you.
It is good to see you. So, let's get right into it.
Yeah.
You saw Dr. Tanio and Dr.
I see
Choi.
Dr. Tanio.
We discussed heart-healthy diet.
Yep.
You're on like 2 medications.
Yeah, I readjusted all my meds and got everything going.
Okay.
So I feel good. I feel great.
Okay.
It's been a month since surgery. Coming home made such a huge difference. The hospital, they're professional, it's a hospital, but coming home was such a great part of my recovery, and having somebody come here helping me was huge. It just made such a big difference, and I knew that I was going to get better faster at home. The home care is the nurse. Carla's been great, but also she's been so knowledgeable. She's really helped me to understand a little bit more about where I am, what I need to do moving forward, and recovery moving in the long term. That's a big thing with a heart care patient. It's not just today, it's the rest of your life.
I can't think of one patient who wanted to be in a hospital, not one. They're always very grateful to be able to be home and have the support in the home. You see everything in what we do. There's not one size fits all in home care. Yesterday was a good example. My first patient of the day is a complicated CHF-COPD patient who has multiple wounds, has a lot of lab work. My next patient, I went to see an LVAD patient who also had cholecystitis, recent sepsis, has just a lot going on, also a very complicated patient. From there, I went to another wound patient and then 2 other teaching patients that were diabetic related. Patients that have trachs or pleuroxes or drains, they just had surgery. You see everything in what we do. When I'm in a person's home, I'm just with that patient. There's no call bell. There's nobody calling me to another room. I'm there. Good. All right, you can breathe normal. So when you're in the home, you get them back into their comfort zone, and you really can help them organize their life and structure things so that they can be successful. Nothing new going on there. Good, okay. And you told me you were having a lot of pain over the weekend in your knees. You're having a lot of your arthritic pain.
My knee.
So left. Can you tell me how bad it was on a 0 to 10 scale? Remember, 10's the worst.
Like 6.
Like a 6?
Mm-hmm.
Okay.
How's it going, Mike? Good to see you again. How's it been since the last time I saw you?
About the same.
About the same? Well, why don't we start with some vitals?
For the patients, home care represents the chance to heal and recover in the place where they want to be, away from the noise, the crowd, and the constantly changing roster of caregivers in a hospital or other institutional setting.
All right, right, good. 97.7, that's perfect. I got lucky. I found this job in home care that was exactly the type of work that I love to do. Pediatrics, again, my calling. I love working with kids, and I am comfortable with infusions, and I thought home care would be a really nice fit for me to get away from the hospital environment and into the patient's home to take good care of them. Ready for your infusion?
Oh, yes.
Okay, get you started here. You really start to build a rapport with the patients because we try to keep continuity of care. I see the same patients over again. So we become very familiar. We have a set routine, a lot of the patients that I see. So it makes our flow go really nicely. Everyone's comfort level is already high because we're familiar with each other and the process that we have. And so visits go very smoothly. Have you been feeling more fatigued lately with the low hemoglobin?
Not particularly.
Not particularly, that's good.
I would recommend a career in home care to other nurses because I think that it really challenges a nurse. It makes you sharper because you're working alone. This is a very autonomous job. It's so satisfying. It's so much more satisfying to me than anything else or any other time I worked in the hospital setting.
I'm really glad I came to home care. For me, as important as I felt being in the hospital was, it is so much more valuable to me to be able to help people change their own lives for the better. I am able to make a difference in people's lives in home care versus in the hospital. I feel like I can really change people's long-term outcomes.
I would absolutely recommend home care. I find it's my niche. After working both in inpatient at the bedside, outpatient at a hospital, home care is where it's at, and it's where I plan to stay for a really long time.